Hello, and welcome to another episode of Wellness Wednesday with Dr. Mike Morris at Chittenden Dental. Today I want to talk about something very personal and very important, I think, for you all to know about, tonsils and adenoids. So I've had more sore throats than I care to think about or to count. I've had sore throats and issues with what they called strep throat. They kept diagnosing with strep throat. Maybe I did have it. Over and over again from age 7 all the way up to the point at age 12 that my mother and I were begging the doctors to do something more definitive. We even talked about removing my tonsils. I don't think we even knew what adenoids were back then, but so it was denied, and I think there was not to get into the weeds too much, but there was a big problem in the past. I'm not sure which decade, but years ago, decades ago, every kid got lined up and had their tonsils and adenoids out. So I think the medical world was blamed for a lot of unnecessary removal of tonsils and adenoids, and so they're much more conservative now. But let me tell you, when there are enlarged tonsils and adenoids, I personally can tell you that it can really have a detrimental effect on our growth and development, as well as our morbidity. It can really create a lot of issues with our breathing. And so I have recently had my tonsils and adenoids out, just coming up on 3 weeks ago now. And I can tell you that personally, the lump that I felt, the tightness in my throat is gone, my sleep is improved, my breathing is improved, and I feel a really significant improvement. And as an adult, it is quite a significant surgery, but as a child, and when I say significant, I mean it's not difficult surgery, but it is quite painful to recover from. So the best thing to do is to have the tonsils and adenoids out if they are a problem when we are children. And so having a very good diagnosis, which starts with a 3D image and good history and really understanding if there are any symptoms that are related to enlargement of the tonsils or adenoids, very important and can have a significant impact and improvement on our health. So for Wellness Wednesday, definitely if your child is having snoring, sleep-related issues, chronic respiratory or upper respiratory issues, as well as sore throats or recurrent sore throats, definitely, even if they're not having any of those things, they can have a little bit more nuanced things like behavioral issues, ADD, ADHD. Those are often related to sleep, really sleep deprivation. So have your child examined, and if as an adult you're having any of these issues, definitely, again, more difficult as an adult, but in my opinion, personally worth it. Thank you so much. Happy Wednesday.